Pneumonia in children, causes, symptoms and treatment by Dr. Srikanta JT.
Pneumonia is considered as the number one cause of under 5 mortality, that is children under age of 5 dying because of pneumonia is considered as the number one or to a certain extent number 2 cause of mortality in India. So what is pneumonia? It is infection of the lung parenchyma. So what do you mean by lung parenchyma? So when we take a child's lung, it is made up of breathing pipe which divides multiple times and then opens into balloons. These are called as alveoli, and then after the alveoli you have blood vessels which travels through those alveoli, which carries oxygen and carbon dioxide, so that when you breathe in the oxygen goes in, and when you breathe out the carbon dioxide, which is the waste product, goes out. And beyond that there is a layer called as pleura which is abutting your chest. So this is in broad framework the lungs per se. So when I tell you about pneumonia, it is the infection of the balloons or the alveoli. So the bacteria gets into your alveoli and starts multiplying, and that leads to something called as consolidation. So what do you mean by consolidation? It produces lot of secretions or phlegm which becomes thicker, and as the bacteria starts multiplying, dividing, from 1 becomes 2, 2 becomes 4, 4 becomes 16, 16 becomes 64. The same way inflammation as well as the phlegm starts increasing and then forms a solid tissue. So that is called as pneumonia. So when this pneumonia develops, the child becomes sick, child becomes breathless, child starts having cough and starts having other symptoms. Like commonest causes of pneumonia are viral, bacterial, atypical bacterias, mycobacterias as well as atypical mycobacterias, and most commonest of all these are viral and bacterial infections. And among viral infections, the most commonest are, it can be influenza, para-influenza, RSV infection, rhinoviral infection and other viral infections. But when we consider bacterial pneumonia, the most commonest are Streptococcus pneumoniae, Staphylococcus aureus, Haemophilus influenza or non-typable Haemophilus influenza, atypical mycobacteria, so on and so forth. So most commonest are viral and bacterial, and that is what we find in our day-to-day life.
What are the symptoms of pneumonia and how is pneumonia diagnosed in children?
The commonest symptoms of pneumonia are number 1, fever, which is high grade, unrelenting fever depending on the organism. So it can be a viral as well as a bacterial. So if it is a viral, especially influenza, adenovirus, RSV infections or Streptococcus pneumoniae or Staphylococcus aureus, you will have fever which is insidious onset. Insidious means it starts off with low grade temperatures, and over 24 to 48 hours it becomes very high grade temperatures, which even after giving the usual paracetamol or other medications doesn't get better or still continues to have significantly high spiking temperatures. And cough, which also can be a very common symptom in the early part of the disease as well as when the pneumonia starts recovering. And most important is breathlessness. So breathlessness is an extremely important symptom in children. So when you look at a child and you keep your hand on the tummy, and if the child has breathlessness, that is breathing faster, that is for a child less than 3 months, anything more than 60 is called as severe pneumonia, and anything between 3 months to 2 years, anything more than 50 is called as severe pneumonia. You need to definitely look at the breathlessness. And in children less than 3 months, it's extremely important that we start looking at signs of dehydration, child becoming lethargic, persistent vomiting or unable to take feeds. These are all very subtle signs of pneumonia. And children more than 3 months, breathlessness, poor feeding, lethargy, is also a very common symptom of pneumonia. In total, fever, breathlessness, difficulty in feeding, lethargy, vomiting or post-acid vomiting, these are the commonest signs of pneumonia. So, how do you diagnose pneumonia? Diagnosis of pneumonia is usually clinical. A lot of people ask me, do you need an X-ray to diagnose pneumonia? Absolutely no. The pneumonia is a clinical diagnosis. If I have a child who walks into my OPD, I document a temperature and child has intercostal retraction, that means more or less this is pneumonia. The only thing is I have to rule out, is it a bacterial pneumonia or a viral pneumonia. Bacterial pneumonia, it is unrelenting fever which doesn't get better without antibiotics, whereas viral pneumonia, child is breathless. At the same time, when the child is afebrile, that is when the fever comes down, child actually gets back into life. But very severe pneumonias do not, so that's a different story. But normally that is how we diagnose pneumonias. And for the completion, that is if I'm able to not hear any sounds or I'm able to hear different sounds, then I will supplement it with a chest x-ray. So according to WHO criteria, pneumonia can be diagnosed clinically without actually needing a chest x-ray. If you can do a chest x-ray, please go ahead. If you do not have one, doesn't mean that you cannot diagnose a pneumonia.
What is the treatment for pneumonia in children, and how much time does it take to recover from pneumonia?
So, excellent question. Pneumonia is classified as no pneumonia, pneumonia and severe pneumonia. No pneumonia, where child has only fever, a little bit of cough but no breathlessness or no intercostal retractions. Pneumonia, where child has all the three of them and saturations are normal. And severe pneumonia, child has everything with respiratory rate according to the child's age slightly faster and saturations less than 92. If it is viral, if it is influenza induced viral pneumonia, we treat them with antiviral. If it is RSV, then symptomatic therapy with oxygen and other things. But if it is bacterial pneumonia, we treat them with antibiotics. So pneumonia, we usually treat them with oral antibiotics if the saturations are normal and ask them to review in 48 hours. If it is a severe pneumonia, we ask them to get hospitalized and treat them with IV antibiotics, and that IV antibiotics will be reassessed after 48 hours depending on the child's condition, and if the child's condition is getting better, we continue the same antibiotic. If the child condition is worsening, then we look for complications, and depending on the complications, we either change the antibiotic or do measures that can pick up the complications and treat the child accordingly. So if it is just a pneumonia, we usually give them 7 days of oral antibiotic and ask them to review after 48 hours and then after 7 days, and usually 3 days of oral antibiotic is reasonably good enough to not only control but also treat pneumonia, but 7 days is mandatory.
What are the complications of pneumonia in children?
So the commonest complications that we have come across in children with pneumonia are, number one is pleural effusion, that is there will be a fluid that gets collected between your lung as well as chest wall. So it can be a uncomplicated pleural effusion or a complicated pleural effusion where there is bacterial invasion into the pleural space that causes significant amount of body's material, that is lymphocytes, neutrophils pouring inside, causing lot of exudative material, that is pus like material, and developing a complicated pleural effusion or something called as empyema. That's number one complication. Second complication is the lung itself, the alveoli or the lung parenchyma can itself undergo necrosis and cause necrotizing pneumonia. Third complication, there is something called as pneumatoceles. The lung parenchyma, because of the damage, starts increasing in size and forms small cysts. This is the third complication, and because of the third complication, a child can develop pneumothorax, that is, one of the cysts bursts open that communicates between the lung and the pleura, and there can be air that can develop in between the lung and the pleura, causing pneumothorax, which is again a medical emergency. Apart from that, child can also develop other complications which are not related to the lung parenchyma, that is syndrome of inappropriate idiot secretion, that is you start peeing more, because of which the salt starts becoming lower. Apart from that, you also develop complications like sometimes pulmonary embolisms because of some pneumonias, and most importantly, the most dreaded complication is lung abscess, which can go on for months together, sometimes requiring the whole part of the lung to be removed. So in general, these are the commonest complications, and most commonest of among all these are empyema and necrotizing pneumonia, which we are seeing in the last 3 to 5 years quite commonly.
How to prevent pneumonia in children?
So the most important step to prevent pneumonia in children is vaccination. So we all know pneumonia is caused, at least in urban centers, purely because of Streptococcus pneumonia, and we have a vaccination that can prevent this particular disease from happening. So it's extremely important, if possible, if feasible, please vaccinate your children with appropriate vaccine, a pneumococcal vaccine, which is not only time proven but also as efficacious as any other vaccine in not only prevent pneumonia but also able to prevent other complications because of Streptococcus pneumoniae, specifically ear infections and severe bacterial infections. So that is of paramount importance. Apart from that, there are other vaccines which we recommend for children, especially for the winter months, like influenza vaccine, which can prevent flu causing severe pneumonias in children, and varicella, that's an extremely important vaccine which has to be promoted, because children who have varicella or chicken pox, their immune system is weakened, and that leads to something called as Staphylococcus aureus secondary bacterial infection, which can lead to significant complication. So vaccination is of paramount importance. The second is nutrition. Nutrition is extremely important. So we can see that children who are undernourished as well as obese is increasing in our society. Any child who is undernourished is exposed to infections, and those infections he will not be able to fight, and that is how you develop pneumonia. And if you are able to have a good nutritious food, you have adequate antibodies and adequate immune system which can not only fight the infection but also prevent a complication. Is extremely important to do that, and that is adequate nutrition. And last but not the least, extremely important, wear a mask, use hand sanitization, so that either you give an infection or take an infection from anybody, which is going to go a long way.